A 2-year-old child presents with chronic diarrhea, abdominal bloating, and failure to thrive. Symptoms improve after switching to a lactose-free diet. What is the most likely diagnosis? A. Celiac disease. B. Lactose intolerance. C. Irritable bowel syndrome IBS. D. Cow's milk protein allergy. Correct answer B. Lactose intolerance. Lactose intolerance occurs due to a deficiency in lactase. Lactase is the enzyme that breaks down lactose, the sugar found in milk and dairy products. Without enough lactase, lactose remains undigested in the gut. This leads to symptoms like diarrhea, bloating, gas, and abdominal pain. These symptoms typically appear after consuming dairy products. In this case, the child's symptoms improved after removing lactose from the diet. This strongly supports the diagnosis of lactose intolerance. It is important to differentiate this from cow's milk protein allergy, which involves an immune response to milk proteins, not lactose. A 14-year-old boy presents with sudden onset of severe scrotal pain, nausea, and vomiting. On examination, the affected testis is tender, high riding, and has a horizontal lie. What is the most likely diagnosis? A. Epididymitis. B. Testicular torsion. C. Inguinal hernia. D. Hydrocele. Correct answer B. Testicular torsion. Testicular torsion is a urologic emergency. It occurs when the spermatic cord twists, cutting off blood supply to the testis. Symptoms include sudden severe scrotal pain, nausea, and vomiting. On examination, the affected testis is tender, high riding, and may have a horizontal lie. Immediate surgical intervention is required to save the testis. Epididymitis, inguinal hernia, and hydrocele do not present with such acute symptoms or findings. A 3-year-old child presents with recurrent febrile urinary tract infections, UTIs. A voiding cystourethrogram, VCUG, reveals backward flow of urine from the bladder to the ureters. What is the most likely diagnosis? A. Vesicoureteral reflex VUR. B. Posterior urethral walls. C. Neurogenic bladder. D. Urolithiasis. Correct answer A. Vesicoureteral reflex VUR. VUR occurs when urine flows backward from the bladder to the ureters and kidneys, often due to a defective valve mechanism. It primarily affects young children and can lead to recurrent urinary tract infections and kidney damage if untreated. Diagnosis is made via a voiding cystourethrogram, which grades severity from 1 to 5, that is mild to severe. Early intervention is key to preserving kidney function. A 7-year-old boy is brought to the clinic by his parents due to concerns about his behavior at school. His teacher reports he frequently interrupts lessons, has difficulty waiting his turn, and often leaves his seat during class. These symptoms have been present for over a year and occur both at school and at home. What is the most likely diagnosis? A. Autism spectrum disorder. B. Attention deficit hyperactivity disorder ADHD. C. Oppositional defiant disorder. D. Generalized anxiety disorder. Correct answer B. Attention deficit hyperactivity disorder ADHD. ADHD is a brain difference that makes focus, impulse control, and sitting still more challenging. It's not about being lazy or undisciplined. Your brain might jump between thoughts quickly, make you act without thinking, or give you this restless energy that's hard to ignore. It's like having a powerful engine with sensitive controls. The good news? ADHD comes with strengths too, like creativity and hyperfocus on things you love. Doctors can help with strategies like breaking tasks into smaller steps, therapy to build skills, and sometimes medication that helps your brain shift gears more smoothly. Plenty of successful people, from athletes to business people, have ADHD brains. They just learned to work with their wiring instead of against it. A 5-year-old girl presents with bright red cheeks and a lacy erythematous rash on her extremities. She recently had a mild fever and cold-like symptoms. What is the most likely diagnosis? A. Measles. B. Rubella. C. Parvovirus B19 infection. Fifth disease. D. Scarlet fever. Correct answer C. Parvovirus B19 infection. Fifth disease. Parvovirus B19 causes fifth disease, a common childhood illness. It starts with mild cold-like symptoms, that is fever, runny nose, followed by the classic slapped cheek rash on the face and a lacy red rash on the body. The rash may come and go for weeks, but isn't usually itchy or painful. Kids are most contagious before the rash appears, and the infection typically clears on its own without treatment. While usually harmless, it can cause complications in pregnant women or people with blood disorders. Good hand washing helps prevent spread. Key points: nicknamed slapped cheek disease for its distinctive rash. Mild illness in most healthy children. No specific treatment needed. Important to recognize in pregnancy. A 4-year-old boy presents with global developmental delay, autistic behaviors, and macroorchidism. His mother reports a family history of intellectual disability in male relatives. Physical examination reveals a long face, large ears, and joint hypermobility. What is the most likely diagnosis? A. Down syndrome. B. Fragile X syndrome. C. Angelman syndrome. D. Prader-Willi syndrome. Correct answer B. Fragile X syndrome. Fragile X syndrome is a genetic condition that causes learning difficulties and behavioral challenges. Boys are usually more affected than girls. Kids with Fragile X syndrome often have trouble with speech and learning new things, anxiety in social situations, unique physical features like a long face and big ears, hyperactive behavior, or trouble paying attention. It is caused by a problem in a specific gene, that is FMR1. This specific gene is important for brain development. While there's no cure, early help with therapy like speech and behavior support can make a big difference. Many kids with Fragile X syndrome are very friendly and loving once they feel comfortable. Key facts: runs in families, inherited condition, more common in boys. Special tests are needed to diagnose this disease. Help includes therapies, not medicines. A newborn baby passes its first stool shortly after birth. What is this first stool called? A. Colostrum. B. Transitional stool. C. Bilirubin. D. Meconium. Correct answer. Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.